TRICARE Overseas program, top is TRICARE Standard, very much like the TRICARE Standard plan, but there are no network providers, or TRICARE Extra is not an option that's available to you overseas. You don't need to enroll in that, just like TRICARE Standard and Extra, and you receive care from any provider in the host nation without referrals. But if you need help locating a provider in the area you're going to be in, you'll want to call the regional call center or visit the TRICAREoverseas.com website. TRICARE Overseas program does have some cost considerations, just like in the United States. They have annual deductibles and cost shares, and you may have to pay up front first and then file a claim for reimbursement. But again, you'll want to check the website for more information on that, or call. TRICARE for Life is the benefit that comes available to you if you become Medicare eligible or reach the age of 65. It's an automatic coverage. As long as you've picked up Medicare Part B, it's a seamless, Medicare being the primary and TRICARE crossing over and picking up the remaining 20%. Medicare pays 80%, TRICARE 20%, unless it's a non-covered Medicare benefit. You just have to make sure that you're eligible in DEERS and that you picked up Part B once you become Medicare eligible due to either age or disability. And it is a uniform benefit. So you don't pay an enrollment fee for TRICARE for Life. You just need to pick up Medicare Part B and pay the premium through your Social Security. How do you find a provider? You can see any TRICARE authorized provider. You just need to make sure that they accept Medicare. They'll accept Medicare if they're a participating Medicare provider at Medicare's reimbursement rates. If they say they're a non-participating Medicare provider, they may be able to bill up, just like a standard provider, up to 115%. If it's an opt-out provider, Medicare pays nothing and TRICARE pays 20%. So you just want to check very carefully with your providers before you see them so that you know up front what your costs are going to be. If you're seeing a provider overseas, you can see any host nation provider that accepts your insurance, and or you can be seen at a military treatment facility on a space available basis. Claims and customer service are handled by Wisconsin Physician Service, and this is their toll-free number. So all overseas TRICARE for Life beneficiaries, which we're talking about being covered as TRICARE Standard, are going to be sent to the TRICARE Overseas P.O. Box, which is listed here on this slide. Any additional information can be read on the TRICARE for Life through the TRICARE.mil link. So let's look at some of the other TRICARE benefit information. First of all, we were talking about the maximum out-of-pocket. Maximum out-of-pocket when you were on active duty was $1,000, but once you transition into retirement, it's a $3,000 family maximum out-of-pocket. And what that means is if you ever reach $3,000 with your enrollment fees, deductibles, and your pharmacy copays, TRICARE picks up at 100%. And our benefit year goes October 1st through the end of September. Things that do not count toward that maximum out-of-pocket or the catastrophic cap are any point-of-service deductibles and cost shares, or that 15% additional fee that non-network providers might charge you. The key to you keeping your benefits updated will always be through DEERS. So when you access the pharmacy benefit, your DEERS information, like your address, needs to be up to date. You need to have a written prescription and a valid ID card. And our policy or the DOD policy on prescription drugs will always try to dispense with a generic when it's available. And if you have tried the generics and you can't take a generic and you need a name brand, then your doctor needs to send in a medical necessity on the brand name that he wants to have it dispensed for you. The other option is if there's no generic, then the brand name is going to be dispensed. And you can look at what those costs are on the TRICARE.mil website. I can tell you that as of October 1st, 2011, if you're on a generic medication, you can go through mail order pharmacy and they will mail generics, 3 months of generics if that's the way the prescription is written. They will mail that to you at no cost to you. So mail order pharmacy is a very good option as long as you don't have other health insurance, and we'll get into that also. The cheapest option in terms of pharmacy is always going to be the military treatment facility or MTF pharmacy, because it's not going to cost you anything. And as long as it's a formulary medication that they carry, and all MTF pharmacies carry the same formulary, they will fill up to a 90-day supply of most medications. And you can locate the closest military treatment facility if you go on the TRICARE.mil website and then do /MTF or military treatment facility. Your next cheapest option is going to be the TRICARE mail order pharmacy. And as I said, those generics are going to be mailed to you for free as of October 1st. The copays on the name brand and the non-formulary medications are going up, but if you go through mail order pharmacy, the brand name, which was currently $9 or was $9, will be mailed to you 3 months for $9. It's going up to $12 at retail pharmacies. But you can call Express Scripts and talk to them, sign up for mail order pharmacy, or any questions that you might have on pharmacy. You can call that Member Choice Center number there. The retail network pharmacy would be your next option, and that would be going to a place like CVS, Walmart, Stop and Shop. And they're going to fill at a 30-day supply, unless it's written as a 3-month. But if it's written as a 3-month, they're going to charge you 3 times 3 in terms of the copay. So if you have a generic medication at the retail pharmacy that's going up to $5, they're going to fill 3 months at $15. Whereas if you went through mail order pharmacy, those generics would be free. If it was a $9, which is going up to $12 copay, if it was $12 at the retail pharmacy, it's going to be 12 times 3 if the prescription is written as a 3-month supply. But you can access what pharmacies are available by going to the express-scripts.com / all capital letters TRICARE, and there's a link there for locating a pharmacy, and you can pull up which pharmacies are in retail, which retail pharmacies are in network. There are also about 60,000 retail pharmacies here in the United States, so odds of not finding one are pretty slim. The most expensive option is going to be going to a non-network retail pharmacy, and I would say if there's not a network pharmacy near you, you may want to avail yourself of the mail order pharmacy. The TRICARE Retired Dental Program is a coverage that's available to you and any eligible family members, and it accesses any licensed dentist. You can see any dentist, but when you're seeing network dentists, the costs for you are going to be a lot less. And they will file all claims for you, and they do accept TRICARE's reimbursement rate. There are no network dentists outside of the United States. There are some dentists overseas, but they're not part of the TRICARE Retired Dental Program dentist network. Enrollment's required. You can enroll just right before you get ready to retire. If you do enroll before you retire, or just within a short time frame of retirement, I know that the Retired Dental Program will put you right into their enhanced plan, where if you wait, let's say 6 months or more, and then enroll in the Retired Dental Program, you'll have to go into the basic plan and wait a year before you get into the enhanced plan. There's a 12-month commitment when you sign up for Retired Dental Program, and the monthly premiums are going to be based on zip code, and you can call or research on the website to find out what that monthly premium is going to be. There is no cost for preventative services like exams and cleanings, but you can research this stuff, as I said, on the Retired Dental Program's website. Okay, other health insurance. TRICARE will always typically pay last after all other health insurance with the exception of Medicaid, and you would follow your other health insurance's referral and authorization rules. When your other health insurance pays first, you don't need a prior author referral from TRICARE, but you'd want to check again with regional contractors if there are any exceptions to that, and I know there's one or two. That OHI is always going to be the primary payer, and then TRICARE will pick up after that. But keep in mind that you're only responsible for TRICARE's allowables, so if your other health insurance pays more than TRICARE does, it takes away having to make any copays or cost shares through your other health insurance. So you want to make sure you tell whatever doctors that you're seeing that you also have TRICARE as your supplement, and they probably will not collect copays from you because they have to reimburse you. You can use TRICARE's pharmacy, mail order pharmacy, only if your other health insurance doesn't cover the prescriptions that you need, or if you've met that benefit cap and you need to have that something like that in writing so that you can supply that to mail order pharmacies. But you're always able to still use the military treatment pharmacy even if you do have other health insurance. A supplemental insurance is a good plan if you're living in a non-prime service area and you have TRICARE Standard. It may cover some or most of your out-of-pocket expenses. Every one of them is a little different, so you want to do some research there as well. That website has a listing of supplemental programs. Make phone calls, take notes. But remember, they're not necessarily going to cost you a lot because your maximum out-of-pocket for the year for family is $3,000, and so those supplemental plans know that they're not going to be responsible for more than that $3,000. But you do need to understand that they're not going to cover things that TRICARE does not allow. So you might have to also keep receipts to supply to that supplemental insurance. Okay, let's go over again some of the things that we've discussed. Your regional contractors in the North region, it's TRICARE Health Net Federal Services. TRICARE South region, Humana Military, and out in the West region, it's TriWest. And these are their websites and their phone numbers. And on the right side, you'll see the overseas regional contractors, International SOS, Eurasia, Africa, Latin American, Canada, and Pacific. We've also got a new presence in the social media like Facebook, MySpace, Twitter, and YouTube. So some information is available there. You can try just searching under TRICARE and pull up what's available there. TRICARE.mil is a very good website for additional information. And that MTF locator, if you go to that TRICARE.mil/MTF or Google Military Treatment Facility Locator, as well as the same with the TRICARE Service Center Locator. You can Google TRICARE Service Center Locator or go to the TRICARE.mil website and /contact us. An easy way to do that, too, is to just call your regional contractor. Social Security Administration is the one that you need to contact for TRICARE for Life or Medicare-related questions, and this is their phone number, as well as Medicare's website and their phone number. If you're having claims issues, that's not something your regional contractor can pull up. That's something that you would need to go through either TRICARE for Life or through the Medicare, if it's a Medicare issue. In closing, I'd like to thank you for attending today's briefing, and if you would like to submit some feedback on slides or anything that you feel might be helpful with the next briefing, please feel free to go and fill out the evaluation on the presentation. And again, thank you for your service and congratulations on your retirement.